counseling is something which is absolutely essential for each one of us, because some or the other smaller or bigger counseling we always do, and it is absolutely essential. I am sure Dr. MKC Nair sir must be remembering that way back, might be 15, 20 years back, when you started this adolescent counseling and conducted a 2 weeks program in Trivandrum. Myself and other colleagues were probably there in the first batch of adolescent counseling, and I must confess that that helped me a lot. Apart from generating interest, that helped me a lot, not only in counseling per se, but in talking to the patients in my OPD. So I welcome all the delegates, and I assure you that this will not only help you while you are talking or counseling the adolescent, but I'm sure this program will improve your communication skills. This program will empower you in your day-to-day practice also. And any program where advisors are like Dr. Bhave Madam or Dr. um, Bafna sir, and the program director is Dr. MKC, rest assured Dr. Hima Bindu Madam has a perfect team of speakers. They are really experts and doyens in their topic. So I'm very sure that this program will be a great success. Congratulations to all the delegates. Staying ahead of the curve, she was telling that within a day, more than 25 registrations were there. So it indicates the necessity of this program. And I'm sure it will take you just months to provide this. In a nominal amount of money you can register, because if you pay for something, you take it very seriously. So congratulations to all. I am really very happy and excited. Wonderful initiative. Congratulations to entire institution. Thank you.
Thank you, sir. Thank you. Touching 180 registrations, sir. Within a few days, we had, actually crossed 100. Is showing 100 registrations, and I think we have to repeat this program maybe after some after 6 months. We have closed the registrations now. So that was the demand, and thank you. I really welcome all the delegates. There are many senior people among this group. There are many colleagues and young faces who have shown interest in adults and health. I didn't know most of them till I saw the registrations. So it shows that the adults and health is really getting a lot of importance in our society. And many youngsters are also joining the Adults and Health Academy. That is a very nice, good news to us, and we are really geared up to give quality adults and health care throughout the country. Now, I request Dr. Uday Bodhankar, sir, to please launch the program, sir. As a past president of IAP and has been, you have been our guide and mentor to many of us. Your blessings mean a lot to us, sir.
Yeah, yeah. Thank you, Dr. Hema Bindu, madam, for the honor bestowed on me. I salute first, as Dr. Bansal sir said, teacher of teacher and my own professor, Dr. MKC Nair. Yeah, he was instrumental in launching the first adolescent teen clinic card in my clinic in 2000. I think he may remember. It is more than 25. Salute to you, Dr. CP Bansal sir, who has been the most dynamic president of IIP during his tenure. Dr. Hema, all of you must know that the stamp in the name of IIP was only released only during his presidency. So salute you, Bansal sir.
Yes, sir.
Dr. Swati Bhave madam, told talked to me today. We discussed she is not well. She has been operated. So in her
Yes.
absence, I salute Swati Bhave. Padma Shri Dr. Bapna, who is very close to me from Rajnandgaon. Dr. Madhushi Deshpande, Dr. Toteja, who is been in America. I think all of you are responsible for taking AHA to this greater height. You are celebrating 25 years. Also, I would like to mention Dr. Hema Bindu, who is the most vibrant chairman from Hyderabad, which is my birthplace. So, Madam, salute you. Dr. Geeta Patil from Bangalore. I have been known her since more than decades. She is hailed from Solapur. Dr. Sushma Desai, who is going to be chairperson elect. Madam, regard to you, Dr. Arya, who called me as a secretary, Dr. Gadekar, who is a treasurer, Dr. Shamika Ghosh, joint secretary, Dr. Prashant Karya, who is in America in absent, and all the speaker, Mr. Bansal, Dr. Joshi, and Dr. Savita. I think all of you deserve special accolade from all of us for taking AHA to this greater height. In your email of Dr. But today, I think more than 20,000 plus people are there. So I think the AHI is a jealousy. I must say it is jealousy for all the other branches of CIP, because this is the most vibrant, which is the most talked about and most delegate. And we welcome all delegate more than 100 plus. I think on the line. I think today is a great day. You can say Dr. Vasan Katkar, who talked to me yesterday, is in San Diego. Dr. Neelam also is there. I think all of them are on way back from IPA, Mexico. So with this, I think I will just say two words. I'm really happy along with Dr. MKC, Dr. Bansal to launch the flagship program on counseling of adolescent, which is a very burning topic, and this is being celebrated during Silver Jubilee. So I think all the speakers, all the faculty expert are there. One thing I would like to say is that in recent years, the adolescent counseling has evolved significantly, integrating new research, technologies, and culturally responsive methods to better support the complex needs of teenagers. Here are some of the major. I will just name few in 1 minute. What I could gather was integration of technology and digital tools like teletherapy, mental health apps, and AI chatbots, which like Bobet offer. Secondly, trauma-informed approaches, which is there. In addition, culturally responsive and inclusive therapy, neuroscience informed therapy practices, holistic and strength-based model. I think this is what recent advances in counseling has come to our health, mindfulness and somatic therapy, peer counseling and group therapy innovation, and collaboration with schools and families. Here, I would like to mention, Hima Bindu Madam, with your permission, that more integrated model to involve school counselors, teachers, pediatrician, parent to support the adolescent across environment. Focus on improving communication and creating consistent support system is very necessary. I think this is what, in short, I compliment all the office bearers of AHM most vibrant what today elect Kotwal is here from Nagpur. All the delegate I welcome you, and I'm really happy along with Bansal MKC Nair with Bapna to launch this flagship model on adolescent counseling from basic to advanced. Advancement, which some of the point I mentioned, I think Dr. MKC Nair is going to elaborate. Other speakers are there, Doshi Madam, Bansal. So with this, I thank you, Dr. Hema Bindu, for giving me opportunity to. It's a great honor for me as a past president. Thank you very much.
Thank you, sir. We are extremely honored. We are honored by presence of both of you. I acknowledge the presence of our Vice President, Dr. Preeti Galgali, and
Acha.
I request Dr. our advisor, Dr. Pukraj Bafna, sir, to please few words that we can go to the program because
It is always pleasure to listen to Bapna Sir Padmashri. Which is
Bafna, sir, Pukraj Bafna, sir, advisor, Dr. Swati Bhavya, madam, we are
yeah.
missing her, but she'll be joining us at the last session. She's undergoing surgeries, so
Yeah.
she
Thank you, Hima Bindu
excuse
ji.
us.
Thank
Yes,
you,
sir.
Hima Bindu.
Yes, sir.
हर शख्स इस जहां में खुशियां
वाह वाह
तलाशता है, पर खुशनसीब होता है जिसको खुशियां तलाशती हैं. Friends,
Wow.
this program under the directorship of our Guru, Dr. M.K. Nair, and our great friend, Dr. Bodhankar, our very, very great friend, Dr. C.P. Bansal, and all the dignitaries who are here. This is a program for empowering the mind and encouraging the life, not only of the adolescents, but of the pediatricians and teachers also. And so far as Dr. M.K. Nair is concerned, हर जगह इत्र नहीं महका करते,
वाह
कभी कभी शख्सियत भी खुद महकती है। और बोधनकर साहब बोधनकर साहब तो कहते हैं कि ये जो प्रोग्राम्स होते हैं ना,
हाँ
ये तो चौराहे के की तरह हैं जो एक्सीडेंट्स को रोकते हैं। तो आज के प्रोग्राम में जो होगा वो हम इस माध्यम से, काउंसलिंग के माध्यम से किशोरों के मन में झांको, उनकी
वाह
स्थिति को आंको
वाह
और उसके बाद हाँको। किशोरों को तलाशने की हिकमत सिखाएगा
बहुत
ये सर्टिफिकेट। एंड so far as Kavita is concerned, she works for the cause, not for applause.
yes
So I must congratulate everybody who is with this program, particularly Dr. M.K. Sinayar, who is the head for this program, and I'm sure this will be a great success. और मैं बहुत बहुत बधाई देता हूँ, and I'm sure जो लोग इसमें participate कर रहे हैं, they will be highly enriched with the adolescent program, and this silver jubilee year of Hinma Bindu will be the great success. Congratulations again. Thank you so much.
Thank you so much, sir. And while we have all the seniors and experts in various sessions, now I request Dr. Kavita to start the technical program, and I hand over the session to her.
Thank you, everyone. Thanks a lot for your words of wisdom and blessings. I think, ma'am, you were calling Dr. Preeti
Yes.
Galgali, ma'am, also.
Dr. Preeti
Galgali, ma'am, are you there?
Yes, I'm here, Kavita.
Yeah,
I wish
please,
the
ma'am, your few
program.
words of blessings.
Yeah, I wish the program the very best. I'm so happy that what we started last year as a small program is going on a broader platform, and I wish the program the very best. Let's continue learning from each other. MKC sir, thank you so much for continuing the little seed last year. Thank you so much. I'm sure it is going to grow into a beautiful, learned plant. Thank you once again.
Dr.
Thank
Sushma
you, ma'am.
Desai
Thanks
ji.
a lot.
Dr. Sushma
Thank-
Desai ji.
Ji. Sushma, ma'am.
A very good afternoon. It's always a pleasure being with such a elite group of the dignitaries from HNIB. My humble pranam to my Guruji, Dr. M.K. Sinai sir, respected Dr. C.P. Bansal sir, inspiration to all of us. Now, sir, cheerful and very inspirational Dr. Uday Budankar sir, dignitaries from Adolescent counseling, as we all know, is one of the most important integral aspect of adolescent health practice. So, knowing about the techniques and intricacies of adolescent counseling will surely help all of us, the pediatrics, to handle in a better way. So I congratulate heartily to Dr. Hima Bindu, the Silver Jubilee Chairperson of AHA, for taking up this program as a President Action Plan. Looking forward to learn a lot through the series of this webinar. Thank you so much and all the best for the very innovative webinar series. Thank you so much.
Dear Sushma. Now one word from Dr. Geeta Patil ji, our past chairperson.
Yes, Madhavi. And I think we have started on the auspicious note by taking blessing from CP Bansal sir, Bodhankar sir, Pukraj Bapna. And when course director is MKC sir, definitely everybody is going to learn a lot. Wish you all the best, and I'm very happy that I am also part of this program. And we definitely assure you that everyone will be benefited by this program. I think you have to log on regularly whenever the dates are given. Thank you very much for giving opportunity. Wish you all the best, Dr. Himabindu team, as I am also part of that team. Thank you very much.
Thank you. We are all there. Now, I think one few words before Kavita and Jayashree takes over. I request all the participants to please join on time for the next sessions. Today, we just delayed for 5-10 minutes for the inauguration. We started early, actually. So for the next sessions, attendance will be taken and a pre-test will be posted in the group. So I request to Kavita and Jayesh to please post such instructions in the group so that they are on time. Yeah, they should attend the full session, and anybody missed will be giving the recording only to them. But it's better they attend the session and then encourage interaction and participation. Over to you,
Yeah,
Krishna, to
thank you, ma'am.
conduct
Thanks
this.
a lot. Thanks everyone for your words of wisdoms and blessings. So, proceeding further to the academic session, today we have special speakers with us, Dr. MKC Nair sir, Dr. Geeta madam, and Dr. Sangeeta ma'am. So, I'm introducing Dr. MKC Nair sir. Although Professor Nair sir needs no introduction, but as a ritual, I'm reading his CV in as short as possible. Sir is a former Vice Chancellor, Kerala University of Health Science, founder, Director of CDC Kerala, past IAP President. Sir is a true leader in both his vision as well as actions. He relentlessly worked towards developing new screening tools and innovative training methods for over 3 decades, and now globally acknowledged as a pioneer in the field. Professor Nair sir had a long research career and with many international journal publications and author and editor of many medical books. He received Doctor of Science degree award for his 25 years long research and follow-up of LBW babies. His 44 years of counseling experience helped him immensely in establishing student guidance and support programs in all the colleges. Sir has established national benchmark in the process. Sir has been elected Fellow of National Academy of Medical Science in the year 2020. Currently, he is working as director named Spectrum Child Development Center Research Center. Sir has been nominated as government body member of many institutes at Kerala. Sir is a national authority in pediatrics and adolescent pediatrics. An annual conference of both the academic bodies have oration on his name. Welcome, sir, and thanks a lot for always being with us. With this, I hand over to Dr. Jayashri to take further introduction of the next speakers. Dr. Jayashri?
Thank you so much.
Yeah.
A warm greetings from Coimbatore and my sincere respects to all the seniors who have found time to grace the occasion today and also blessed it with words of wisdom. Now I'm happy to introduce the two speakers, the star speakers for today, Dr. Geeta Bansal ma'am and Dr. Sangeeta Joshi ma'am. Dr. Geeta Bansal, as we all know, does not need any introduction. She is a Karamveer Chakra awardee. Ma'am is a master trainer for various programs of IAP like MSU, AYA, and Mission Kishore Uday. And also she is an expert in adolescent counseling. She has done various certified courses to her credit, including the Royal College of Pediatricians, University of Sydney, and she has held various posts in IAP, AHA, and Women's Wing. She has publications to her credit. She has also contributed to various journals and the books released by AHA. We are very happy to have you here, ma'am, as our first launch speaker. And coming to Dr. Sangeeta Joshi, ma'am, she is a practicing pediatrician with special interest in adolescents, and she is an expert in this field, current person of Chhattisgarh AHA. She is an active member of Central AHA, and she has been part of various counseling programs held in the topic of adolescence. She has been the past president of Women's Wing Chhattisgarh and also IAP president of Bilaspur in the year 2021. With these few words, I extend a warm welcome to all the three speakers, Dr. MKC Nair sir, Dr. Geeta Bansal ma'am, and Dr. Sangeeta Joshi, to take over the session. Thank you so much.
So good afternoon. Myself, Dr. MKC Nair, a most respected chairperson of AHA, Dr. Himabindu, all the senior dignitaries of AHA, my dear colleagues. We are already 25 minutes late, so I won't take time. I am not a speaker, by the way. I am only trying to be the guide. We have two speakers who will talk. I will button in between if necessary. That's all. There are three clear objectives why we started this program. Number one, this these 10 sessions, you're not going to become a counselor or something, but you will get an idea about what counseling is all about. Only a simple introduction. Whereas next year, we may do advanced counseling course with real little more strong purpose. But the idea here is, third objective is that we will have a second generation who will feel confident to talk and hand it over them. Please put on the slides. Slides, please.
Geeta Bansal, madam.
Yes.
Geeta? Yeah.
Yes,
Put
sir.
your slides. Let's start.
I'm sharing the screen, sir.
Yeah. Okay.
Make it slideshow.
Dr. Sangeeta will be starting the session.
Okay, it should be slideshow, I think.
You can put it as slideshow.
ऊपर दिख रहा है.
Yeah, I know. Okay, I'll do it. Dr. Sangeeta can start.
Sangeeta, Dr.
Yeah.
Sangeeta.
Perfect. Go ahead.
Dr. Sangeeta? Unmute yourself, Dr. Sangeeta.
Mute. Yeah.
Vivek, please unmute Dr. Sangeeta. Yeah.
Good afternoon, respected dignitaries of and on the dais. At the outset, I would like to thank our dynamic chairperson, HA, respected Hima Bindu ma'am.
You are muted.
Sangeeta, you are muted.
Now, am I audible now?
Yes.
Okay. So, good afternoon, respected dignitaries on and off the dais. At the outset, I would like to thank our dynamic chairperson, AHA, respected Hima Bindu ma'am, for giving me opportunity to be a part of this important webinar series on adolescent counseling. Counseling is an important and integral part of adolescents' life, and many a time it's a game changer. But somehow, in our medical curriculum, there is hardly any dedicated lectures allotted for counseling. So in our busy OPD, when an adolescent steps, many a time, general pediatricians, they are in a fix and have many queries regarding counseling sessions. So today, we are privileged to have with us stalwart of adolescent health, respected MKC Nair sir, who would solve all our queries. And in this session, we would be talking about the basic counseling, whom and how to begin, counseling type and steps. Next slide, please. So let's begin with what actually counseling means. Different people have defined counseling differently.
Sangeeta,
But to sum up,
just a minute. I want to just
Yeah, ma'am.
request the group who are there to please answer the pre-test while they are. Pre-test is posted in the group. Please carry on.
Yeah. So let's begin with what actually the counseling means. How is it defined? It is defined differently by different people. But to sum up, it is a form of talk therapy specifically designed for teens aged 12 to 19, focusing on their mental and emotional well-being. Counseling helps them navigate developmental changes, process emotions, and address mental health concerns in a safe and supportive environment. It can also assist with issues like behavioral problems, substance abuse, family dynamics, and academic struggles. Next slide, please. So, in short, basically, it is a talk therapy when there is conversation or dialogue, and there is no place for preaching or command. Active listening is most important. So now we come, okay, what is the need of this adolescent counseling? So counseling, it supports mental, emotional, and social well-being during a period of significant growth and change in hormones that we see during adolescent phase. It also helps teens navigate challenging issues like identity struggle, peer pressure. It provides safe place to explore feelings and developing skills. It also helps in relieving the mental health issues. Next slide, please. So whenever a teen is confused regarding relationship issues, finding it works. When needed skills as assertiveness have not developed, counseling will help. And when one can't snap out of turmoil or depression. Next slide, please. So we can say counseling is required for adolescents with non-assertiveness. That means when adolescent is not able to take stand for himself, or there is sudden scholastic backwardness without any obvious reason. There are adjustment difficulties, like if parents are transferred to another city, or school is changed, or home is changed, and many a times teen is not able to adjust with these surroundings. So that time counseling will definitely help. Similarly, if there are behavioral problems, antisocial activity, borderline personality, there are mood disorders like bipolar disorders, anxiety, depression, or early markers of personality disorders like self-identity crisis, interpersonal functioning and emotional regulation issues, impulsivity, anger issues, and so on. Next slide, please. So, when an adolescent is brought to us or he comes on his own, he basically wants answers or solutions to his queries, which he doesn't get from his parents. He wants better grip over his feelings, behaviors, relationships, and worries. An adolescent has many questions like, who am I? How can I be less anxious, less angry, less shy, or less frustrated? Why do my relationships fail? How can I handle my worries about my weight and appearance, that is, body image issues? How to manage my inability to focus? So they are seeking someone who can understand them and help them understand themselves. Next slide, please. So we can say goals of counseling are to promote self-awareness in teens, facilitate personal growth, resolve emotional distress, improve interpersonal relationships, develop problem solving and coping skills, promote behavior change, support mental health recovery, enhance decision making skills, improve quality of life, and prevent future problems by making them self dependent. So, when to counsel? If an adolescent enters our chamber, we must see whether there are any physical or mental symptoms developed recently that are out of expectation, or child is lagging studies recently without any obvious cause, and it should be between about 12 years of age, between 12 to 19, because here is the age when teen develops that much understanding. Now, suppose one adolescent comes to us. So we have many questions like whether adolescent needs counseling, whether he should be counseled separately, or he should be counseled with one parent, or both the parents, grandparents, whether we should counsel him first and then parent, or vice versa. Then how frequently child is to be counseled, when he should be called again for follow-up, then how long, like for how much duration counseling should be done. So these all are the questions, and I would request respected MKC sir to please have your expert comments on these questions.
Okay. Normally, adolescents don't come by themselves. Sometimes they do. The parents bring them. And one of the problems they always have is, if you see the parents first, they no more trust you because they think the parent has already polluted. So don't do that. Try to see both of them together first. Make pleasantry talk. And in fact, sometimes I jokingly say, why have you brought your mother? Does she have a problem? Turn the table. Instead of saying the mother has brought you for a problem, you ask the child, why have you brought that? You look like this, and then you'll say, no, 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 she has brought me and all that. So somehow you need to tell the child, I am on your side. Otherwise, he or she will never talk. That's the number one. Grandparents, you can be, but after the initial introduction, then you ask for permission to have the child sitting with you alone. And three precautions have to be taken. Number one, if you are having a glass door or something, the child should pull the curtain away. Very, very important. If you do it, child will forget that I have done it. What is the message that you are giving? I am actually your safety. I am guaranteeing you your safety. You pull the curtain. And outside the door, glass door, the mother should sit. So that mother can see what is happening inside, but at the same time, they cannot listen to what is happening. And number three is don't start with a bombarding question. You always start with an open question. How do you feel today? Have you got a problem? Why have you come? Very general topics, not that did somebody hurt you, did this happen, don't do all that. So that is something way to do. How frequently depends on person's need. Don't push the counseling too much. I always tell, better whenever you feel like you please come. I don't give a schedule. Some people teach you to give schedule 1 week, then second one, third one, like that. It doesn't work like that. Because we may think you are a great counselor, but the child probably didn't like you so much. It's not your fault, nor the child's fault. Sometimes equation doesn't work. Human relations, equations doesn't work. So you give the option to the child that when you feel like comfortable, you can come. But by the way, within a week, that deadline you can give, but anytime you can call me and come. So how many times again depends. The child may say, I'll see you tomorrow again. If she wants like that and if can afford to give space, do it. No problem. And never do it in an busy OP. Normally what we do is a particular day is fixed or particular afternoon is fixed where you have finished your busy OP and then you give the time. If you are given the time, stick to the time. If you have a casualty duty, don't give a time. I'm talking about pediatricians who are very busy. So give a time and stick to the time as far as possible. And if you can't for some reason, apologize. Say that I got an emergency. Sorry, better. I can't help it, but I will come back as quickly as possible. How long? There is again no fixed hours. Usually I take about an hour, sometimes maybe 2 hours even. The reason is the first opportunity is the greatest opportunity because you have already established a rapport with the child or the girl, and then they want to tell the maximum in that day. And one important thing you should remember is you should introduce yourself, who you are, what you are. I always say, I have been doing this business for so many years. There's nothing in the world nonsense I have not heard. After all these years, I have heard every rubbish you can think of. Don't be afraid to talk because I'm so used to hearing every nasty thing also. Don't worry about it. And then say, third thing you should say is 100% confidentiality. I will not tell out anything to anybody except two things. If you are repeatedly getting abused now, then I have no choice legally but to tell your parents. But if somebody pinch your bottom 10 years ago, I'm not bothered. That is not an abuse now. That is not something which is bothering you now. But if you are at the risk of getting abused, then I have to tell. If you have intention to commit suicide, again I have to do because that is legal. Except these two, nothing else. Whether you have boyfriend, what did you do with the boyfriend? Nothing of that sort. Tell clearly that I have no negative ideas about any of the sexual relations or something. It's all your choice. But I will only do that I will tell you what is the consequence of that. We will discuss what is the consequence, and and the most important counseling that I have seen is, especially when they come with the love affair, which is the most difficult one. I always give them a homework. Go and tell 5 or 6 of your friends who had love affairs what happened to. Surprisingly, they'll come back next week, sir. All of them got into trouble. So you are not giving any message whether you should have a love affair or not. But you understand that at one extreme, everything can be like bits and boots. On the other extreme, things can be bad. You are not advising, you are not even guiding, you are just making things clear. I hope I have explained.
Yeah. Thanks a lot, sir. Thank you for your insights. Now, we are going to put one MCQ. This MCQ is for participants. There may be more than one answers. All the participants are requested to write their answer in chat box. And after some time, we'll tell the result. So the question is, counseling can generate a variety of outcomes: facilitating behavior change, enhancing coping skills, promoting decision making, improving relationships, and all of the above. I repeat, counseling can generate a variety of outcomes: facilitating behavioral change, number one; number two, enhancing coping skills; number three, promoting decision making; number four, improving relationships; and number five, all of the above.
So someone can see the answers in the chat box, and after 1 minute, we'll declare the answer.
So I think most of you got it right. So answer is all of the above. Next slide, please. So now we are coming to a very important slide, the essential qualities for the counselor. 3 essential qualities of counselor. It was given by Carl Rogers, one of the American psychologists. Number 1 is empathic understanding, most important. Listening carefully, understanding, and communicating accurate perceptions of that understanding to the client is of utmost importance. Careful listening is very important, and teens should feel at home. He should be confident enough to share his problems without fear of getting judged. Another one is unconditional positive regard. That means being able to communicate to the client that they are of value, they have worth as individuals. Warmth, acceptance, respect, and regard while setting limits on certain behavior. And congruence or genuineness is another quality that a counselor should have. That means behaving in a manner consistent with how they think and feel, that they be genuine. Other important skills being attending, paraphrasing, reflection of feeling. So, sir, I would request you again to kindly explain all these in details.
Last one, I forgot to say one thing. One more thing you need to remember is you must give the choice to the child that if you are embarrassed about some answer, just say, I don't want to answer or I am feeling embarrassed. But never bluff. The problem is if you bluff, if a counselor bluff, the counselor understands you are bluffing. And somebody sit and bluff in front of me, my mood will go away. So never bluff. Give them the option. I am sure some of these questions are embarrassing to you. It may not be for me. It will answer that now. Maybe I will do it next week. That's okay, but don't bluff. That's one thing. Now, here 3 things she said: empathetic understanding. Empathy is a word we all use, but we don't understand. Okay. It's so difficult to put yourself in the shoes of somebody else who is in trouble. You know, a young girl lost her husband. Can you ever imagine what she is going through? Never. We cannot. A mother of an autistic child, you can you imagine what she is going through? No. We cannot understand what depth of sorrow that she is going through. Still, we can still support the mother. And don't keep on talking. Just touch the mother, touch the girl, just touch, put a hand on your shoulder. It is okay. It is okay. We can help you. You know, that is enough. Empathy is something which should come from the heart. You don't have to say your empathy. The person should perceive it. But the other person should perceive. It's like love affair. The other person should understand, perceive your caring, perceiving your rain. So perceive is the word most important. Second one is unconditional positive regard. Now, when you talk about God, we say what is bhakti? Bhakti is unconditional positive, trust in the God. You have no questions asked. You give me good, okay, I will accept. You give me bad, then also I have no problem. It is very easy to say like that, but now at this age, I have realized it is possible. Even if you are sitting on a volcano, I have no complaint because I know that it is his decision. If he has decided, it must be for good. It must be for my good. I have to take it as like that. So similarly, a positive regard is very important. I'll tell you, person sitting in front of you should feel the value of themselves, the worth of themselves, and you have to have that warmth, acceptance, respect, regard, all that. In North India, it's much easier to do it because you have a word called beta, not beti. Even if it's a girl, you call beta. You call beta kaise, the moment you say call beta, it becomes a very, very affectionate way of addressing. And that is something which we can. More important is congruence. What is congruence? It's not genuineness alone. Congruence is a state. The counselor must be congruent as much as possible, not fully, never possible, because counselors themselves may have to go for counseling. In fact, in America, you are supposed to go for counseling every 6 months, I suppose. You have to go for counseling to make sure that you are okay. The counselor is okay. So similarly, congruence is that your thinking, behavior, and action should be on the same plane. You say I'm very pleased with you, but your face says I'm going to murder you. That cannot do. That cannot happen. We should have things. And how do you teach congruence to the child? Take time. It doesn't come quickly. First time you can't have. But at the end of 5 or 6 sessions, the child should be, or the girl or boy should be become congruent. That means they should be able to express their feelings, their thinking and behavior on the same level or same. Then there are a lot of other things called attending. What is attending? We always joke about psychiatrists, only joke. I'm not seriously saying that psychiatrists will sit there. You can keep on talking and he'll switch off the brain. Then half an hour you keep talking. Yes, 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 in between only. That's only a joke. I'm not saying they do like paraphrasing is very important. What is paraphrasing? You actually need to very effectively summarize what the client has said. Did you say like that? Did I understand correct that you were saying, referring to like this? It is not a summary in the usual sense. It is the way you understood what the client is saying. If she is showing too much of sadness, do I understand correctly if I say you are a little extra sad today? That is paraphrasing also. Not only summarizing, but trying to understand the exact, the state of mind of the child. Reflection of feelings, again, similar to that. You are reflecting the whatever saying. Did I hear it correct? Sometimes they may not say anything, but they may show it in body language. So did I got it correct? Your reflections of what it is. And of course, the plain summarizing. Summarizing summarizing is there. You don't have anything else. Just say that 1, 2, 3. Can we summarize what happened today's counseling for record's sake? Let me keep it. But mind you, most clients won't like you to record it. Although officially it is supposed to be done, most clients, in my experience, the moment you pick up the pen or the moment you start writing something, they stop talking. So recording should be in your mind, because if only one client in front of you, you will be knowing if you have affection for that child, if you have affinity for that child, then you will be remembering every word that he said. I suppose this is what it is. Okay,
Yeah.
madam.
So now there's one important query, ki whether we need to counsel our patients only the teen who is in trouble, or anticipatory guidance is also to be given by us. So, sir, will you please tell what is your say on this?
Basically, anticipatory guidance, it should be only a group counseling or group guidance or group there. Here, we are not talking about individual problem. For example, you are talking to a batch of students, a batch of trainees. Okay, suppose we are getting a group of teachers. There, we say general things. Say, what do the teachers feel like? What are the problems teachers face? What are the problems from the students feel? It is much more general saying, to saying that you are vouching that what you are going through is something which we understand that you are going through. Somebody has to, accept that we do go through this. By then, half the problem is solved. So that is one way of doing it. Then you don't have to do a real one-to-one counseling. What you can do is many techniques there. You ask the groups, you write down what your problem, one word in a slip of paper. That's what I always do. You collect all the papers without name, nothing, no identification. So you get problems of 40, 50 people. And then when you talk about it, it actually is almost like a counseling. Whereas if you spend 1 hour, you can spend only one problem. Here, many general problems can be covered. This is one way of doing. Then normally what I used to do is, after you take the general class about issues and all that, then one by one, the children will come to you in front of you. Half a minute, 1 minute, not more than that. But they should sit there. They should sit in front of you. And most of them, what they say is, they'll sit there, nothing, sir. They laugh and go away. So that you know that there is nothing. Some of them may want to sit there. Then you spend time. So there are many ways of doing all this in a simple way. But if you think the child has a problem, don't say in front of everybody that you have a problem or something like that. Just give a slip. We need to see you again. Okay? We'll see again today or tomorrow, whatever it is. So nobody knows that you said something, but the child, or if they have a slip of paper, you write on that, and they will see. Or tell them that we'll see today after everybody. Most people have gone. Few of them will wait. They want to talk to you little more detail. So these are the simple ways of doing it in a school environment. Okay.
Thank you, sir, for such a nice explanation. Now we quickly move to one case. Karthik, a 14-year-old boy, comes to my clinic with his mother for a routine checkup for URI. He is an old patient of mine who I have been seeing since his childhood. Mother reveals that he doesn't listen to her nowadays since a couple of weeks. He keeps insisting for outside food and has started avoiding social family gatherings, which he used to enjoy earlier. And now he prefers to talk to her friends who are girls, like girls in his class. And also, he wants to spend more time with his peer group. Though there are no concerns about school, his scholastic performance is quite good. Next slide, please. Next slide, Geeta ma'am.
इसको भी हटा दूं?
So on detailed psychosocial assessment at home is a nuclear family with healthy atmosphere. Both parents, they are educated and quite dedicated for their children. Parenting type is authoritative. In education part, he is scoring well. Equally interested in outdoor sport activities. He plays cricket, he plays basketball, also takes swimming sessions. Now, for diet, he is interested more in outside food. Sexuality, safety, spirituality, there is nothing abnormal. So, as per me, these are the normal physiological changes of puberty. And here, this child doesn't need counseling as such, though we can give him guidance about nutrition part and importance of exercise. So here, I think rather mother should be assured and counseled if needed. Sir, what are your views regarding such
So
case?
basically, majority of the children coming at this age between 12 and 14, 15 are, they're just transition adolescents. They are changing from a dependent to independent state. They are not become independent, but they are craving to become independent. And here the counseling actually is required for the mother and the father, particularly the mother, because this boy or girl has been clinging on to your clothes, listening to you, everything. You are the ultimate world for them. And suddenly you change, you start becoming independent. You don't listen to me. You talk back at me. You do this one. You think I don't need it. Everything upset the mother. But the mother should be taught to sit and smile. Why sit and smile? Because my son or daughter is now growing up. I say earliest sign of growing up in not only physically, but mentally and emotionally. They want to venture into the world on their own, and that's a great thing. And particularly about sexuality, is very, very important to warn the mother that this is the time when they start fiddling with their genital organs. They will do like this, they will do like this. It's a shocking thing for most parents. I don't know how they had the children. If they didn't do any of this, how did they had the child? But they should know. It is not something. Sexuality is not something you put a switch on and it will become okay. No, it is a long period of minor changes. So that you need to tell. You need to tell the girl may have little wetness there. I mean, if she is excited about something, she may get wet. The boy will have erection. No, and if you are talking in a school, then we talk in a different language without telling the words. But mother need to be told what is normal, what is physiological, what all you can expect. And particularly about self-stimulation. And this is the usual problem when you have a child with a disability. The problem is the normal child somehow know how to hide some of this. So there's no problem. A disabled child will do, mentally retarded or intellectually disabled child will do openly. And why I'm saying is, I had done a huge program in a deaf and dumb school, or not in deaf and dumb school like that. Girls who are deaf but studying in a university, this thing. And a PhD project was done. There, my difficulty was I'm talking to them in the English, and the interpreter is talking in sign language. And then only I realized the simple knowledge that we think the children acquire from outside, they don't acquire because they can't hear anything. They can't overhear people whispering. They can't understand the body language of other people. We learn all this from our servants, from people around. Great aunties who are smart ones will teach the girls. Those who come for work, in and around the house, they will be cracking joke. The boy will pick up something. We pick up a lot of things from outside, which these children don't pick up. So the answer, one word answer to it, more than the child may need reassurance, but the mother need psycho education. Important.
Thank you so much, sir. Now our next MCQ is, a counselor should have three essential qualities. A, he should be busy on his phone. B, should tell the details to parents when they come in about the child. C, empathy. D, unconditional positive regard. And E, congruency or genuineness. I repeat, a counselor should have three essential qualities. A, should be busy on his phone. B, should tell the details to parents when they come in. C, empathy. D, unconditional positive regard. And E, congruency. Please type your answers in chat box. I hope everybody has done right. So answer is C, D, and E. We should make it a point that we should fully concentrate on the child and should not look for our phones. And also secrecy is to be maintained. So with this, I hand over to Dr. Geeta Bansal for further proceedings. And thank you all for patient listening. Thank you.
Thank you, Dr. Sangeeta. Good afternoon, everyone. Thanks to the silver team of AHA for giving me this great opportunity. Sir, I had this case of 15-year-old adolescent boy suffering from ADHD. He had been diagnosed previously, and he was rusticated from the school because he had become very aggressive lately. His mother is a GNM nurse in a government hospital, and she has handled her 2 kids single-handedly, as her husband was posted in another town for the past 10 years. And recently, he has been posted back to the hometown, and he has come back home. So now the problems have started. She accepts and understands her son, and she wishes that he should become a nice, positive person who can take care of himself and family sufficiently enough. She does not expect him to top. She has somehow managed to come with both son and father for the counseling session to me. The father, an engineer, feels ashamed of his wife and her job definition, as his friends are all doctors and engineers. He is forcing her to quit her job and teach the child at home. He refuses to accept that the child is having ADHD and feels that the working wife has spoiled the child in his absence. So, sir, how can we help this family?
So basically, we need to identify where all things have gone wrong. The first one is 15-year-old adolescent boy, and he is suffering from ADHD. That means he's a difficult child or problem child. Problem child not for you, the problem for the child himself. He is not able to manage situation in the school. He simply doesn't know what to do. Nobody has, helped him to cope with his problems. So naturally, he will behave badly. One behavior, bad behavior, will give the label of a difficult child, and then it goes on. And from one teacher to next teacher, what happens? The bad name goes on. So he becomes the bad boy of the school. So naturally, he will have resentment, he will have anger, he will have frustration, and you don't know what he is going to behave the next moment. Now, this is complicated by, this is the background of the child. This is complicated by a father who has his own problem. The mother seems to be reasonably settled. Reasonably, she's okay. But the father has his own problem. What is his problem? He is an engineer, okay? She's married to a A&M or something like that. Isn't it A? Yeah, a GNM. It's general, simple nurse, not even BSc nurse. So his stature issue come. The idiot doesn't understand that you are not married a GNM, you are married a woman. And this is very, very important. It is not a qualification that is important. It is your wife. And you have to learn to give respect to her, irrespective of her profession. Because tomorrow, if you stop getting the job, you lose the job as an engineer, she will still support you as a husband. So that part he doesn't understand. So naturally, he is not happy with the situation. He is not sure what is happening. And you have a problem child. It becomes whole irritating for him. So naturally, what happened? The family dynamics is completely collapsed. Here, actually, ideally, you need a family therapy. And what is a family therapy? We'll discuss later, maybe. The difference between the child's problem alone, it is simple counseling.
But the moment three other people are involved and they are all interacting negatively with each other, okay, then it becomes a family pathology. It is a family pathology that we need to search out. So the first level is his level of ADHD, how that can be managed. Second level, and the problems of the child, that is first step. The second step is between them. What is the relation between husband-wife relation? That's very important. Later on, maybe we can say we have a simple tool called partner assessment scale thermometer, which we use for all parents, at least mother, where we talk about your happiness, reality, in reality, how happy you are, in fantasy, how happy you are, okay, how much support you have from the family and friends. Then you talk whether you believe in the concept of marriage. Then you ask whether your sexual life is happy or not. Here probably it is not a GNM which is bothering him. Even if his sexual life is happy, GM, ANM or whatever won't bother him, because that he'll be happy with that. But here there may be problem. I'm not saying he's in there. There may be problem with his sexual life, and he may be an authoritative person, So what happens? He push all his ideas on the mother. Okay. Then what happens? What happens? His wish only should happen. So the whole blame comes on the. This is exactly what happens in any other place. The blame is all on the mother. What the hell you are doing? Just because you are outside, you will say you are outside. So I gave the money. She should have looked after. No, after 10 years when you came, if he got a first rank in the school, then you would have taken credit. It's my son. That's why he got it. When something goes wrong, you put all the blame on the mother. So there's a huge problems here. Can we attack all this straight away? No, you can't. Because if you say more, it will further worsen the family. So initial stage, you focus only on the child and tell the mother, I understand that there are other issues, but let's not complicate it now. Let's talk for the child. And if you need further help, then we can go for a family therapy or different thing. I think that will solve the problem.
So thank you so much, sir. And you were talking about the tools. So, sir, just as you said, pediatricians are very busy OPDs. So, what are the history-taking methods by which we can detect early that this child is having something else, some problem that needs counseling and all?
Yeah, if you talk about heads, which is actually, it was started with 1 years, now 3 years, it is increasing. To record things in a medical college hospital where there are postgraduates, this is a wonderful tool because you get very good record of everything. Okay. But in a busy OP, you cannot do so much of work. So what we actually do is, I don't know whether you are showing that is TSQM, simple 7 questions, which will try to identify the problem. Then there, of course, what is the simple thing that we can do? TSQM, there are 7 questions. You ask a depression. So if it is depression, there are 3 things that you have to remember. You will have sleep disturbances, you will have appetite disturbances, you will have problem with your libido or sexual interest. Those are 3 questions. Then if it is depression, then you need to ask 3 questions. Worthlessness, hopelessness, helplessness. By this 7 questions, you will be able to identify whether the child has depression or not. This can be done in 3 to 4 minutes. You don't need to take more. But suppose you want to again record from very beginning, what was there in the beginning. Next slide, madam. Can you put the next one? The
Yes, sir.
TSQ mentor
Yes,
teen
sir.
screen question.
Yes,
Yeah,
sir.
put. Nobody can read it, I understand, but this is a
Sir,
published.
I will share the tools with them in the group, sir.
Yeah, yeah.
And the earlier one also, which you said I will
This
share.
contains 21 questions which take care of all the hyperactivity, the ODD, conduct disorder, all can be diagnosed. Not only what happened. This is based on the principle that most of the adolescent problems are a continuation of what happened in childhood. So you can pick up all this, whether child had all this before. Then you have some things which are related to puberty and all that, particularly sexuality related. Then you have the classical adult diseases like depression, anxiety, and all that. So if you look at this questionnaire, even I can't read it from here, then you tick it. And some of the question obviously is for ADHD. Some of the questions are obviously for ODD, opposition defiant disorder. Some of them are characteristic of, conduct disorder, CD, or some of them are characteristic of ASD. So if the child had all this in childhood, definitely in adolescence, 15-year also will have all this problem. So that's what we should do. That's how these two questions help. This is a published one, so you can quote it anywhere.
So then how should
England
we?
tool. Sorry, madam. There is an England
Yes.
tool, which of course you are not given, so it's difficult. It takes some time. What I routinely use is the England tool, where what we can do, the questions will tell you what is the suggestion, what sort of problem you have. But I think we don't have time for that. Takes
Yes,
little time to do that.
So we'll be taking up the
NDSC.
tools in detail in a later session.
It is called
uh,
NDST, Neuro Developmental Screening Tool, which recently we got that it has almost 99% negative predictive value, which means it is as good as any other. Okay. But only a screening, suggestion, not confirmatory. None of these tools are confirmatory. OP, you can quickly find out.
So what tools would you recommend to these pediatricians to keep in their routine OPD and ask the
Routine
adolescent to
OPD,
fill
you
out?
only need to have TSQ. If you want, you can use heads. But later on, if you are an assistant or psychologist, then you can do BDI, Beck's Depression Inventory, scared for anxiety, and PSQ for anxiety, ages and stages questionnaire for particularly for suicide ideation, etc. It is for many other things, but we can also tell you this. This, of course, you need a separate person to do that.
Yes, sir. Thank you, sir. So now
And we have, if any of you are interested, there's a publication in Indian Journal of Pediatrics where we have looked at 500 adolescents in the community and showed all these details as a series of, it's called ADAD series. It is Indian Journal of Pediatrics, which issue I forget now. There is called a 18 article called ADAD series. Exactly all these tools have been used.
Yes, sir. Hello.
Yeah.
Yes, sir. So now we have an MCQ for our participants, and we hope they have learned the name of the tools, and the pediatricians now know which tools they must keep for their adolescent clients. So this MCQ is important tools for pediatricians in mental health assessment are TSQM for mental health screening, SCARE tool for anxiety, BDI for depression, ASQ4 for suicidality assessment, or all of the above. So you all are supposed to write the answer in the chat box. So you have 1 minute. Dr. Sangeeta, please check the answers in the chat box.
E, all the above.
Okay. So all of the above is the right answer, and we'll be sharing all these tools with you in the group.
Yeah, everybody has given it right.
Good. So how should we proceed stepwise for counseling? I personally use the 6-stage model of counseling process designed by Cormier and Hackney in 1987. And I find this very useful. In the stage 1, we do the relationship building. We talk to our adolescent in a general way, just like Dr. MKC sir said. With the child and establish a rapport. And in the stage 2, we do the assessment and the diagnosis with the tools. Once we know what exactly the problem we are dealing with, then we move on to the stage 3, where we formulate the counseling goals. See, here now we are talking about the goals of the counseling, not the goals of his life. The goals of counseling will be designed in collaboration with the child based on his goals, his life goals. For example, I had a girl with depression who could not get up from the bed. So now the goals should be based on the SMART acronym, where S is specific, M is measurable, A is achievable, R is realistic, and T is time bound. So now the goal is not to overcome the depression immediately. The goal is that she should be able to get up from the bed to go to school or college or her job. So she can't get up from the bed because of her depression and she needs help. So the immediate goal is that then we formulated with collaboration the goals, one of which was that you can keep your alarm away from your bedside and on your dressing table maybe, and you have to get up. Now, if she's able to achieve this goal at even for 3 days in a week, so that is measurable. So now there is progress. Now she can go to school 3 times in a week, like that. So the goals of counseling have to be made in collaboration with the patient by discussing what they can do and what they cannot do. At the stage 4, we do the intervention and the problem solving. That I just discussed the way to solve the small problems which they're having and which has become very big for them. And at the stage 5 is the termination and the follow-up. So termination has to be done very gradually. We'll tell you more about how to terminate a counseling later on in a later slide. At the stage 6 is the research and the evaluation, which is very important. Our record keeping should be very good. Once a child has come to us, we are just talking, we are not taking down the notes. We are just taking in codes because there is no time to write down the notes. But later on, I personally, I upload everything, type everything on my IAP software, which I have customized for myself for adolescent healthcare and all the counseling. So all my cases are on my computer. And when the child comes back to me for another counseling session, I always do a recap because everything is there. So how should we structure the first session of the counseling? Obviously, the time should be suitable to all the 3 parties, the parents, because in India, the adolescent is always coming with the parents, or sometimes one parent may come. The child, his studies, his tuitions, his coachings, the time should be suitable to him also. And then to us, of course. Then the room should be quiet and there should be no disturbance. Even our phone should be switched off or on the silent mode. And we must not take the calls at that time. The important thing to talk to the child is the confidentiality. So I generally explain to the child that whatever you are going to tell me will remain confidential. I'm not going to tell your parents about it unless I feel that there is something which may hurt either you or someone else. Even in that situation, I will first discuss it with you and then only reveal it. Then privacy. Your staff should not keep coming inside and telling you someone is waiting outside or something like that. The time should be such that there is privacy. And start with a simple conversation before reaching to the TSQ. Your questions that you ask in the sessions should be open-ended questions. The child should not be able to answer them like yes or no. You should give them an opportunity to open up and talk in detail. So how do we find out that the client is progressing? Generally, what I do is repeat the same tool to monitor the progress. For example, I have found BDI, the Beck's Depression Inventory for Depression, as very good tool to monitor. After a few sessions of counseling, the score goes down, significantly down. And even the child can see the progress. There is evidence. The parents can see the evidence because the child is filling up the forms, the questionnaires himself or herself. So it's really satisfying for all the three parties. Then ask the adolescent how he's feeling. That is the most important thing. And the parent's response also matters a lot. And how should we terminate the counseling? The ultimate goal of counseling is to make your client independent. And this, if you feel at certain stage that the little problems that the client was having, now is able to manage and cope up with them on their own. They have learned the skills, the techniques. For example, we talked about the alarm. The child can't get up from bed. So now he is able to get up and go to school or college. And now he is able to take his bath, freshen up. Because in depression patients, they just stop taking care of themselves. So I'm talking about a patient of depression right now. So if you feel now they're able to cope up with their problems on their own, then the time for termination has come. But you cannot suddenly terminate it because to a certain extent the client is, integrated into getting help from you. You have to plan it several weeks in advance. Start preparing the client psychologically. See, now you have learned how to cope up. You were able to do this also. You have done this well. Maybe we can soon come to our final session, say maybe after 2 weeks or so. Like that, you have to prepare your client. The final session. Now, what we should do in the final session, we must review the whole counseling process. How it started when the child came to us, what were his or her problems, what were the positives we faced throughout the sessions, what were the negatives we faced, what he was able to overcome, and what he's not able to overcome even now. So this all we should discuss in the final session and review the whole thing. Then you plan a follow-up after 2 to 3 weeks. And when the child comes for this session, the follow-up session, you take up all the challenges which they had while they were on their own.
Ma'am, you are mute.
Yeah. My AirPod fell from my ear. Okay. So you should reassure and give a contact number to connect again. You need not give your direct contact number, but you can give a number of your staff or your clinic through which they can get in touch with you at a later date. So now we come to the MCQ 4. The most important to tell a client in the first visit is explain confidentiality, avoid talking to the adolescent, avoid talking to the parents, or none of the above. You have 1 minute to answer that. Dr. Sangeeta, please check the answers in the chat box.
Yes, I am checking.
Answer is A.
Yes. Okay. So answer is A. Explaining confidentiality is one of the most important things you have to do and never forget to do. So this is a problem I have been facing in my cases, and this is addressed to Dr. MKC sir. How to generate parental support. Sometimes the parents believe that the child is just posing to gain sympathy, and they refuse to accompany the child or to even to finance the sessions. And once I even called up a mother because she was having suicidal ideations. And the mother just told me, "Arey, aap chinta mat kariye, wo to aise natak karti rehti hai, apne aap aa jayegi wapas niche." Like that. So I just didn't know how to handle this situation. MKC sir?
Yeah, before coming to that, let me just say one more thing. You have given a beautiful 6-stage counseling, which is good. But from a practical point of view, I don't think they will be able to do just by saying this. You have to split it into doable things. So number one is, breaking the ice we call in a meeting, otherwise rapport building we call. So the number one is rapport with the client. That is the number one. Create rapport with the client, whichever way, there are 100 methods of doing it. Number two is allow the child to ventilate whatever they want to say, or we call it catharsis also. Ventilate. You keep saying talk therapy. You keep on, by saying half your problem is over. Then you look at the context of the child. That is very important. Context means what is the background of the child? You know, if I say, usually I say, suppose a busy gynecologist minting money, her child has a problem, then I know family has a problem. She may say, let the fellow go, I can manage. But suppose it is a poor mother, no job, 3 or 4 girls to be married. She may have to tolerate lot of nonsense. There's no choice. So that context is important, how she decides what to do. So the context is important. Then a person coming for counseling may have many, many problems. You cannot solve all the problems. So ask them to, come down to 3 important problems out of all this. And from the 3, you come down to 1 and say, we will address that problem. Okay. That is from many to 3 to 1. And then who should give the solution? Not you. You are not going to give the solution. The client or the counselee know his or her problem, his or her context, and things that she has not told you. There may be a lot of things which she has not told you. So she knows that very well. Okay. And then she will tell you. And what do you do if she doesn't tell? Do you openly say that I know you have not told me the whole thing? No, never say like that. Other way around, you ask her how many percentage have you told me? Not correct, bluff. Don't say bluff. Okay, and you say I have said, I start with 20%, 30%. They say no, 80% I have said, or 70%. Congratulate the child. You have come to a stranger and you are told 70% of your secrets. That is great. So the rest 30%, next time what after that we can say. And then solution they will say. They should say the solution. Come out with 3 solutions and say, discuss each solution, pros and cons. What will happen if you do it? What will happen if you don't do it? And then from there, let the child decide which one they want to implement. Your job is only to help the child to implement and then get into the termination stage. Here, I think one word is very, very important. As per Freud, the word is called transference. If the child like you so much, sometimes they will say, I remember a child said, my mother, last 16 years, she was with me. She didn't understand me. 5 minutes, you understood me. You get the point. Don't get elated by that. That is only the temporary feeling. Their affection is to mother, not to you. But anyway, but you can make use of, this is called transference. Make use of the transference to make the child do the correct way. She will listen to you the moment she has that affinity with you. But don't misuse that affinity. That is called counter transference. You should not have affinity with the child. You should have empathy and all that, okay, but no affinity with the child. Unnecessary affinity. That will put you into trouble. So if you ever feel it, which you can feel, transfer it to somebody else. I think this is the practical steps that we can do from the 6 stages that you have said. Madam asked some other question, how to generate parental support. Parental support is not easy always. But yet, the basic principle of a mother is she wants her child to be safe. Okay, that is something I've learned from throughout life. Whatever be the problem, unlike the father, which may not be. Father may be little more thinking of his own prestige. If I tell it out, what will happen to my prestige? Mother will, most of the time, not everybody, they will want to have the best interest of the child. So do you take her as a partner in your mission to support the child? Okay, your child is going through this. Naturally, she cannot tell anybody. If she tell the father, father will make noise. Can you be her support? I can be your support, but can you be her support? By and large, I think the mothers will. So take mother as a support person, and finance is a big issue. That is why if you counsel a child alone or an adolescent alone, it doesn't work because she doesn't have the support money to come even
come for counseling. So somebody has to be there, and that could be mother, that could be father. And I'm not saying negative about father, don't take it that way, but by and large, the father may not understand. Whereas, but nowadays I'm seeing a lot of fathers who better understand the child than the mother. That's a new changing trend. But yet, I want to believe that mother is, the one who is always there. So I suppose sometimes you can get both on your side, which is a difficult job, but you can get both father and mother on the child. But there you play not your feeling of right and wrong. Never say right and there is nothing called right and wrong. Okay, it is simply what is in the best interest of the child. Okay, once you decide that you are only interested in the best interest of the child and not what is right and wrong is, it is based on societal norms. We are not interested in societal norms. We are interested what will happen to the child. I suppose, madam, this is the way you can manage.
Thank you so much, sir. Sir, now you have been counseling for so long, and we wanted to know a little about some different types of counseling from you. Here we are talking about the mental health counseling of adolescent, but there are many types of counseling.
Plenty. I don't think first day we should give all this because they will forget what you have taught already. But I just naming is okay. It can be marriage counseling, premarital, family counseling. It can be individual counseling, group counseling, career counseling, mental health counseling, genetic. You can have relationship counseling. You can have self-counseling. There are a lot of methods. That I think we should take in the second stage. Individually, we can, and there are a lot more coming. There are a lot of methods which we are not discussed. We have CBT, cognitive behavior therapy, rational emotive therapy, dialectical therapy. There are a lot of new counseling things are coming. But madam, I think we'll reserve that for the second stage.
Okay,
right
sir.
now, whatever both of you have said is superb, very exploratory. I think this is good enough. You can share the slides with the participants.
So now we come to the MCQs 5.
And one more message I'll tell you, my book on counseling second issue is coming. So later on, you can have a look at that, maybe.
Yes, sir. We are looking forward to it, sir. So the important 6-step process of counseling includes relationship building, assessment and diagnosis, formulation of counseling goals, intervention and problem solving, termination and follow-up, all of the above. So let the people write in the chat box.
Yeah. Yes.
So the answer is, shall I tell the answer? All of the above.
Everybody has done it right.
Correct. So all are with us and all are carefully listening to us.
Yeah,
right?
yeah.
So, sir, I had another query for you. Can counseling alone help without medication? Because sometimes parents tell me not to give any medication. And sometimes the client keeps telling me, Doctor Auntie, give me some medicine. I'm feeling so low or depressed. So I wanted to know your take on it.
We are reaching the end of the session, so I won't take much time. I will put it very simply that what particularly you're talking in terms of depression. So we need to have a biopsychosocial model where the biology is in terms of the neurotransmitter, for example, dopamine, etc. So you need drug therapy. Drug therapy is a must, number one. But along with that, equally important can be the cognitive behavior therapy, but it'll take months and months, lot of cooperation from the counselor and counselee, which is sometimes somehow doesn't happen nowadays. So at least start with the drug, add on, you can do the CBT. That's the correct way of doing. But research says that if you do 6 months perfect CBT, it could be equally effective as drug. But how can you do 6 months and perfectly done CBT? Who is there to do that? So the best option will be drugs. SSRI will be the most important. And one more word I will say, many people believe fluoxetine is the most commonly used drug. That drug will produce suicidal tendency, which is not there. It is not a drug that produces suicide. A severe depressed person will not commit suicide because he has the difficulty of putting the table, then the chair on top of it, then he has to climb there, then he has to put the hook. Oh, it's like, climbing Himalaya. He will say, forget it, I am not interested. Whereas moment you give the drug, what happens is psychomotor retardation that improves. Energy level comes up like anything, but his mood doesn't change. So he is willing to commit suicide, or she is willing to commit suicide, and he has the energy for that. So suicide happens. So most often when you are on drug, parents are told better be careful, be on the watch. Child may do in the first 6 weeks of the drug. That's all. Otherwise, drug doesn't produce any suicidal tendency. Cognitive behavior therapy, if it is good, you can do it. Child cooperate, you can go through all the homework and all that, which never happens. If
Which
it
never
happens,
happens.
it is very good.
Yes, sir.
Okay.
Thank you, sir, for that wonderful answer. So now we come to some do's and don'ts of counseling. So now what a counselor should do. Learn the subject matter in depth. That is most important. You should know your subject well. Self-awareness. You should have clarity of your own thoughts. And it's very important to be non-judgmental. Like I discussed the case of ADHD. I particularly became very judgmental in that case with the father, because I started thinking that this man is doing violence, domestic violence, not treating this lady properly, forcing her to quit the job. And I even told him that, listen, you must allow her to continue her job. So that fellow, he never came back to me for another counseling session. We lose our case. We should never be judgmental. We have to be neutral. And we have to try to understand their viewpoint before being able to counsel them properly. So this was one of my very earlier experiences, and I learned a lot from that. So skills, you should use the techniques clear to you. Like sir named so many techniques just now. So you should learn 1 or 2 skills. And if you're comfortable, like I'm comfortable with CBT. So I'm focusing on one technique. I try to use that. Skill rehearsal. You can improve your skills by rehearsing in mock sessions with someone known to you or your colleagues, and reflecting on self from time to time. We must think about how we are thinking, about how we are going about the counseling process, how we are reacting. Reflection on self is also very important, and application of the theories to real life, that comes with practice, and always keep learning. Now we have some don'ts of counseling. Don't moralize, don't compare with your own life. Always listen very carefully to the client. Don't forget to give some home assignments or action plans at home. And then on the next visit, we must also follow up how well they were able to do those action plans and what were the challenges they faced. Don't criticize, don't be judgmental, and don't overhelp. Sometimes we try to become very friendly, or we start making relationships with the client, which is not a good type of counseling. Take regular feedback of counseling from your clients. Even at the end of every session, we must ask them how their mood is after the counseling session, and what did they really learn something from this session, and what we can improve in the next session. Don't develop a close relationship, and don't ask questions starting with why. They can be really embarrassing sometimes. And don't terminate the counseling suddenly. So now we come to the MCQ.
Madam, just correct that word close into wrong relationship. You can have close relationship, but not wrong relationship. That wording just corrected that.
Okay, sir. Thank you, sir. So now we come to the MCQ 6. Important do's for a counselor are moralize and compare with your own life often. listen carefully, self-awareness and reflection on self, becoming a close friend of the client,
E.
or B plus C?
B plus C. E.
Okay. So now we come to the take-home messages. Be on the lookout for mental health issues during routine OPDs. Learn the simple, quick screening methods to evaluate. The adolescents themselves fill up the forms and give them quickly within minutes. Even BDI, it has so many questions, they fill it within 5 to 6 minutes. Understand the enormity of the emerging problem and your important role of early detection and timely intervention or timely referral. Develop your own network of experts like psychologists, adolescent-friendly psychiatrists, counselors, and other required specialists. Learn the techniques of good counseling. Establish clear-cut goals of counseling in collaboration with client. And evaluate periodically and terminate gradually. Thank you.
Good evening, sir. Nayyar Sahab. Good evening, sir. Good evening, sir.
शशि भूषण जी नमस्कार, डॉक्टर
नमस्कार
राजीव
सर।
सेठ।
नमस्कार राजीव सर।
ओ कैसे हैं सर?
नमस्कार सर, अच्छे हैं सर।
I think
यहाँ पे
everybody is
इतनी
very
बढ़िया
excited.
Yeah,
गुड
one of
इवनिंग
the
सर
best.
नैयर साहब, गुड इवनिंग सर।
Yeah, thank you, Dr. Nair, Dr. Hima Bindu, and Dr. Geeta Bansal, and all the leaders of AHA. बहुत बढ़िया वर्कशॉप, I'm listening every word
राजीव
of it.
सेठ जी, गुड इवनिंग। आपकी सुंदर वाणी सुना मैंने। आई एम
थैंक यू
डॉक्टर
सर। ये प्री टेस्ट मिला मेरे को, तो प्री टेस्ट का लिंक ही नहीं मिला है अभी। प्री टेस्ट तो दे दो भाई, पोस्ट टेस्ट का लाइव आ गया।
Group, sir.
वो पोस्ट टेस्ट भी वही है।
Test link is posted in the group में।
Sir, now you
हिमा बिंदु मालकिनी हिमा बिंदु है, उनसे परे कीजिए।
सर प्री टेस्ट थोड़ा सा लेट हो गया डालने में, बट डल गया है ग्रुप में। नाउ द सेम थिंग इज द पोस्ट टेस्ट। पोस्ट टेस्ट प्लीज आंसर कीजिए। Please answer the post test.
Pre-test should be given half an hour before the.
Yes, sir. Sorry for delay this time. Sorry for delay. There was some issue, sir. But I posted it in the group. But now the same thing is post test. Please answer the post test. We'll see. So it will be fun.
Yeah. The post test also, ma'am.
मैम प्री टेस्ट ही नहीं मिल पा रहा है अभी भी।
डॉक्टर सर अभी पार्टिसिपेंट्स ग्रुप में मिल गया है प्री टेस्ट, प्लीज।
चैट्स में देख रहे हैं आप, ईमेल करवा दीजिए सर।
नहीं, पार्टिसिपेंट्स ग्रुप में सर, व्हाट्सएप में जो।
अच्छा, पार्टिसिपेंट्स में 108।
हाँ, क्योंकि हमारे वाले में तो नहीं
डॉक्टर कविता प्लीज पोस्ट द पोस्ट टेस्ट।
Yes, ma'am, I'm doing it.
Yeah. So I think it was a very nice session. We should congratulate Dr. Sangeeta Madam and Dr.
Congratulations to Hima Bindu Singh.
Sir, thank you so much for your joining this group, sir. आप इतने सीनियर हैं और हम सब लोग फिर भी sir, I would also love to learn more and more counseling from Dr. MKC Nair.
It's amazing, Dr. MKC Nair. You were informed today. Very nicely done, sir.
Yeah.
Yes.
You all have enjoyed your session, sir, and I'm sure, like I was, all of us have enjoyed this session, and more sessions.
Again, you meet on the 6th.
Yeah, we have next session.
Again, you meet on the 6th of the.
Ma'am, can we take few questions now?
Yeah. Please take the questions before we end this session and announce the date of the next session, Dr. Kavita. Please announce the date of the next session before you close.
Yes, ma'am. Let me check it, ma'am.
6th June.
Dr. Jiyashri, please take the few questions.
Shall I do that? So there was a...
Next session is on 6th of June.
Yes, 6th of the June.
Yeah.
Yes.
So request all to
Everyone
please attend on time.
Yeah.
So please go to the questions, Kavita, in the chat box.
Yeah.
Chat box, I'm not able to see any question, ma'am.
So questions are
No
not
question,
there.
no question, no question.
Sir, I have posted 2 questions at least.
Okay.
Okay.
I don't know about the others, but I cannot miss the opportunity to ask some questions. MKC, sir.
Go ahead,
So
Kavita.
my first question was, MKC, sir. So if the patient doesn't turn up for the further counseling sessions, so is it a good practice to give them a reminder to come back or not? Should not be done.
I didn't get it. What did you ask?
So if I did one session of counseling with a patient and then the patient doesn't turn up again, so it is a good practice to give them reminder that you have to come back.
Yeah, you can give a reminder. You can give a reminder.
Reminder should be
But
good.
if you are giving reminder, madam, one second. If you are giving reminder, not after they have not come, before the due date, you give a reminder. Once they have not come, they are not going to come back again because they feel bad.
Right.
If you have make 2 days, 1 or 2 days before you give call and say or message that is a reminder.
Okay. And second question is, sir, often
my
the
question,
problem
can I ask-
behind the teen, difficult teen is a difficult family environment, whether the father is problematic, maybe some other issues in the family. So when the parents do not agree, they are not in the like acceptance mode.
Situation where God Himself cannot help you, how can we mortals help
Can
them?
I ask a question now?
One.
Can I ask a question, Dr. Kavita?
Yes, sir. Yes, sir.
The question is to Dr. MKC Nair, sir. After such a wonderful session, when the faculties for the next session, if they get anxiety and they are apprehensive, how can they tackle it?
So I would like to give you the answer of this question, if you permit me.
Yeah, you can give.
Yes,
You
sir.
can give answer.
When MKC Nair sir is there to cover up everyone, every anxiety goes back.
I'll tell you the story, madam. The Lord Krishna had so many wives, not so many thousands, but at least 8 or something. And wherever you go, you will see Krishna there. So at a time, he was with all the 8.
Sir, MKC sir, you are not comparable. That is what is being said.
No, I didn't say that. I'm just saying about Krishna.
MKC.
People wonder how he is everywhere. How is he managing everything?
MKC.
Please.
Yes, sir.
MKC, something about you. There are 2 important moments in the life. One, when he's born, and second, when he proves why he was born. So you proved why you were born.
Okay.
Wonderful. Wonderful.
Great.
Wonderful.
Thank you.
So that was a very nice session and we had a huge participation. Thank you once again to all, especially to our MKC Nair
Just 1
sir.
minute. Just 1 minute, Himabindu.
Yeah, Dr. Kiran.
Regarding the
Your voice unstable.
test, when there is 1 true or false, how do we select? There is 3 false. So how do we select? Can you please review the questions in
Dr. Geeta, please review the questions.
Pre-course.
Yes.
Yes.
No, that we can do later, madam. We can do later. I have one suggestion. There are a lot of people ask me, why can't you have it between 2 and 4? Just think of it again. Because
So usually
most
OPD
people,
finishes by 2.
no, madam, that is true. But many people start evening clinic and patient will be waiting. So a lot of people are telling
Right,
me,
sir,
why
we'll
can't we
take the
start?
opinion. We'll take the opinion.
Just think of it. I am just suggesting. Think of it.
Yes, sir.
Whether it is
I'll
possible.
post the message in the group and according to the voting, I'll do that.
Madam, post test is I'm not able to do either in the phone or in the.
Sir, kindly, sir, forgive us for this mistake. It happened at the last moment, so I couldn't go it properly with all that.
I have another meeting. Good night.
In the daytime, background noises are also there. In the
Sir, the post test link is already
stop them.
posted. Kindly open the link and answer the questions. Sir.
Ma'am, the post test link is as an editor. It answer that we are.
So these are the initial glitches. From next time, it would be taken
We'll
care.
take care of all these things.
Okay, listen, I can read out the questions to you.
There is one
Hello.
one question.
In what conditions parents should be reveal the things child has shared? There is one question in the chat box. In what conditions parents should be reveal the things child has shared with you?
Only if there is any
Yes.
suicidal tendency, or if there is any, if child is going to do something very bad which is very harmful, then only we should tell to his parents, not otherwise.
I think we can answer these questions in the next session. Meanwhile, please post those Google form again. We'll repost it after we look at the technical glitch, but we are able to open here. So we'll repost it. And the next session, please join on time. I think it's time to say a goodbye and vote of thanks and close this session. I request Dr. Jayashree and Kavita to do the needful.
Yeah. Thank you, everyone. Thanks a lot for wonderful participation. Ma'am, should we take feedback of
We can do it. We have already crossing time. So
quite late actually.
Yeah. So next time we'll do that.
So I think, yes, ma'am. So thank you everyone for your.
Last feedback I can give in one word is, Kavita.
Yes, sir.
श्रेष्ठतम से कोई दूसरा शब्द हो तो बचाना इस सेशन के लिए.
जी सर.
श्रेष्ठतम से कोई दूसरा शब्द हो तो बताना इस सेशन के लिए.
Thank
you, sir. Thank you, sir. Thank you, sir. Thank you, sir. Thank you, everyone, for your such an active participation. It was indeed a mind-blowing session. And getting an opportunity to learn from Dr. MKC, sir, is like blessing for everyone. And my sincere thanks to each and everyone present here. I extend my gratitude to our today's guests of honor, Dr. C.P. Bansal, sir, Dr. Uday Bodhankar, sir, and our today's all the guest speakers for taking such a wonderful session in such a nice manner. Thanks a lot to our respected AHA chairperson, Dr. Hima Bindu ma'am, for this initiative. This program is one of the most loved and appreciated program by the fellow colleagues. Thank you, Secretary Sir, Dr. Prakash Veer Arya sir, Dr. Sneha Gadkari ma'am, Dr. Geeta Patil ma'am, Dr. Sushma Desai ma'am, and each and everyone present here. Thanks a lot to Dr. Jayashree for being with me and supporting me in the conduction of the program. Thanks a lot, CIP, for your unwavering support always. Last but not least, thanks a lot to the technical team who worked so nicely behind the curtain so as to run the program in well-organized manner. Thank you, everyone, for this successful program ending. Thank you.
Thank you. Look forward for joining the next session on June 6th. Thank you.
Yeah.
And I would especially like to thank Dr. MKC, sir. He has been with us at every level. He has guided us for this presentation. Thank you, sir.
And Dr. MKC, sir, was very cooperative. Whenever we called him, he was always ready to guide us.
Yes.
And we really thank him a lot from bottom
We
of our
really
heart.
learned a lot from you, sir.
Yeah. Thank you, sir.
Thank you, sir. Thank you. Thank you.